Bismillahirrahmanirrahim. Assalamu alaikum. Hi everybody. Welcome to the channel. Today I would like to talk about intracerebral hemorrhage and will show you a video clip of a patient who presented to me with hemorrhagic stroke. As you know very well, in brainstem bleed or lesion, the patient gaze will be away from the lesion. On the other hand, in the lesion above brainstem, the gaze will be towards the lesion. This is the CT brain of the patient who presented to me with right-sided intracerebral hemorrhage. And of course, the weakness was on the right side. Look at the patient. On asking to look straight, the gaze is towards right side. As the patient presented with left-sided weakness, so the lesion is on right side. And you see the patient gaze is towards right side. So without CT brain, you can think of lesion above brain stem. Thanks for watching the video.